Hi everyone, my name is Leora Mation and my presentation is on chickenpox and shingles. The varicella virus can cause two distinct diseases. The initial infection is chickenpox and the recurring form is shingles. Both diseases share similar symptoms.
Etiology. These two diseases are caused by the varicella zoster virus, otherwise known as human herpes virus 3. Chickenpox is transmitted from person to person via droplet transmission, which can include droplets from a sneeze or cough, or by contact with clothing, bed linen, or oozing blisters of an infected person. People infected with shingles can spread the virus, resulting in a new case of chickenpox infection. Shingles infection transmits the virus through direct contact with fluid from the blister stage of the rash.
What is the chickenpox? Chickenpox is an acute, highly infectious disease which causes a vesicular rash on the superficial layers of the skin. It is often accompanied by a fever and malaise. The chickenpox rash is characterized by the crops of lesions on the surface of the body. The crops tend to begin on the face, often found inside the mouth and on the scalp. It then rapidly spreads to the trunk and extremities. However, relatively few crops tend to appear on the extremities. Each crop of lesions develop through the following phases. The first phase is the appearance of a red dot called macules. These macules then rise and inflate into the second stage, the bumpy papules. Further swelling underneath the papules leads to stage 3, the blistering vesicles. The liquid then transforms into pus, transitioning into stage 4, the pustules. Eventually the pustules dry up into scabs, called crusts. Sometimes scars form where the lesions once were, especially if the infected individual scratched the lesions during a rash. It is important to note that all stages of lesions may be simultaneously present on a patient's skin, depending on the distinct progression of each crop. Duration of the chickenpox. An infectious period is about 1 to 2 days before the appearance of the rash, and generally lasts until all the lesions have crusted, which is typically 5 to 7 days. The incubation period is typically between 10 to 21 days, but usually spans about 14 to 16 days. After a chickenpox infection, the varicella zoster virus remains dormant in the nervous system and may be triggered at a later time to cause the shingles. After a chickenpox infection, the same varicella virus that lied dormant in the body can be reactivated by triggers. Therefore, this disease only affects people who have had the chickenpox in the past. Triggers may include stress and age, especially in individuals 50 years of age and up. Also, people who are under an immunocompromising circumstance, such as AIDS or cancer, may be more susceptible to this reoccurring condition. Other triggers may include sunburns, physical trauma, and more. An episode of shingles usually lasts somewhere between 2 to 4 weeks. Symptoms of shingles. Shingles is typically limited to 1 or 2 dermatomes that innervate by a spinal or cranial nerve. The image to the right shows the human dermatomes that may store that dormant virus as previously discussed. Symptoms usually begin as a unilateral radiating pain and then erupts as a rash of liquid-filled blisters, much like those that are characteristic of the chickenpox rash. Again, these stages include macules, papules, vesicles, pustules, and scabs. Also, scars may form if the infected individual scratches these rashes. Vaccines and treatments. The chickenpox vaccine is routine for young children. The first dose is administered between 12 to 15 months of age, and the second dose between 4 to 6 years of age. There is also a shingles booster available for people 50 years of age and above. However, there is insufficient evidence to indicate that the booster provides long-term protection. As far as the treatment for the rash go, there are little or no treatments available, beyond treating the symptoms of itching, pain, and fever. People are generally recommended to avoid itching until the lesions have scabbed over and dissipated on their own.